There's been a major breakthrough in chronic pain in a recent study, with the average percentage of 87.29% pain reduction within 5 to 10 minutes. Welcome to the Chronic Pain Academy, where science meets soul and healing becomes reality. Led by the compassionate expertise of Dr. Paul, here are the real recovery stories. Tune in to be inspired, educated, and empowered to take your healing into your own.
The last time we were talking about the effects on relationships, and just to recap, people living together, and one of them is in chronic pain, especially if they're disabled, the other person becomes a caregiver, and it really affects the relationship dramatically, puts some great challenges on the relationship because neither one of them are really getting what they want out of the relationship any longer, and one person feels good and doesn't understand how to get the other person well, and then the person who's sick feels guilty about being sick. They oftentimes don't want to spend any more money because they spent so much, and then they kind of get through this failed hope syndrome where they've tried so hard to get well, but we just were unable to find any real help other than medication, which gave limited help, and then, of course, side effects and health problems coming from the medication itself. And so I was up in Utah. We're going to kind of progress into another step here. I was up in Utah, and this is a woman. This is a video of a woman who took the seminar up there, and what she had to say about it. There she is. This is Crystal.
Hi, I just am working with Paul this weekend. It's been really inspiring. I'm really excited to get out there and really help patients. He's done a great job of really explaining how to work with people and why things are happening in the body and how to relieve symptoms for patients. In addition to supporting in how to set up a practice that's going to be successful, he's done great in really explaining pitfalls so that you can avoid those. And I'm just feeling really confident in taking what I've learned from him and creating my practice. Thank you.
What a sweetheart. So just to give a little bit of a synopsis of what happens when a sick person will come in and see you. First, of course, we'd sit down and take a case history and get all the information, explain to them what we do. But after all of that's done, we would apply our decompression test. And just to give you a little bit of background on that, the decompression test actually takes the pressure off the spinal cord structures. The pressure on the spinal cord structures causes the covering of the spinal cord to pull on nerve roots and create widespread pain, puts you in sympathetic, which gives you it gives you anxiety, it keeps you from sleeping, it upsets your stomach, it shuts down your sex drive. I mean, all of those things happen when you're in sympathetic, and we covered those in part 1, so if you haven't seen part 1 yet, it'd be good to go back and see part 1, but just to give you a quick synopsis of that. So as we apply the decompression test, almost always we'll see a great relief in symptoms. In the last, I think, 3 seminars we were at, 100% of the people responded to the test. Our average in the last study we did was over 87.29% symptom-free on the first visit. And so the decompression test will almost always work for you. Last night we had 100% that worked, and they were all 100% symptom-free, which was really exciting. And then we had a couple of people that came back today in the same thing. And so after the decompression test, we know at that point, because there are different ways of doing it, what it's going to take to get the patient well. We know how to treat them. We know that they're going to get well ahead of time. And we know that we're going to get at least as much as we got with that test, and probably more, and that we'll be able to stabilize them almost 100%. I've only seen a few people, maybe 2 or 3 that didn't respond well after we tested them. And of course, this is out of hundreds and hundreds of people. And it was because of heavy trauma. You know, one person, they both had heavy trauma. One person's neck was pretty much fused, auto-fused, and the other person had torn ligaments that were so bad they just couldn't hold the correction. So after the decompression test, we know what to do. We know that they're feeling better, they're doing well. We send them home. We have them come back and at a designated time, and we want to know how long it lasted, how long that correction lasted before it went back to where it was, because they do, kind of like teeth. It will tell us how frequently to see them. We want that to go back and stay where it belongs. And if you were an orthodontist, you'd do it with braces, but we can't do that when we're dealing with these subtle tissues, and so it takes us some repeated, pressure work to make that happen. So then they come back, they let us know. That tells us how frequently to see them. We set them up on a frequency of care, and this frequency will generally last a couple months. That can vary according to how they respond, but generally a couple months. We set up a prepay program. We give them like a 20% discount if they prepay, and with that prepay, they don't have to come in and make payments every day. We don't have them, have to check in every day. We just go right into the back, and we set them up and work on them, and so after that, in about when they're pretty stable, we have other ways of figuring that out. When they're pretty stable, then we'll start cutting back on their care, and so. We have to figure out how much of whatever they'd spent on the first 2 months. The reason I'm telling you this is because if you're going to take our training and become a practitioner, it just gives you a better idea how it flows and how it works. I really like the part of it where I talk about how this all works and how we make it happen and getting patients well. But if you're going to take the training, you need to know what we're doing, and so that's why I'm going over this portion of it. So, so they prepaid for a couple months. At the end of 2 months, you sit down with them. You figure out what it's going to take to maintain that correction for the rest of the year and do another prepay, and then you're done collecting with them. That takes care of a whole year's worth of care. Each treatment can be, or care provider, depending on if you're a physician or a holistic practitioner, takes about 5 minutes. And so they're not there a long time. Come in there, and especially if they're very sick and you're seeing them multiple times a day, they're happy that you're not going to drag it out and they can get in and out. Most of the people charge $75, $85 for a treatment. If you're a medical doctor, most of them are charging more like $150 a treatment, but everybody's different. This is a little girl. This is one of the most amazing things that just happened recently. We see these things almost every place we go, so I have a lot of these videos like this, but this one stood out to me. I think it's because she was so young and had suffered so badly, and I'll give you a little bit of history, and then you can see what happened. But the history is basically this. She developed pain in her foot that was so severe that it was a real classic, what we call a CRPS, but the pain in her foot was so severe, she couldn't put it on the ground, she couldn't touch it, she couldn't put a sock on it. She was in a wheelchair with a little bare foot sticking out. And then she developed headaches at the same time. They thought maybe she had a spider bite on her foot. That ended up not only with that development of the pain in her foot and then the headaches, but it also turned into grand mal seizures once an hour. I mean, I don't know if you're familiar with the grand mal, but it's pretty scary. I've seen them before, but they still scare me. And so, you've got a poor little girl here that's foaming and jerking, and looks horrible. Well, we were talking with the family, explaining what we did. And, of course, the family's exhausted. They've been up with her 24 hours a day as she went through this. And after the seizure, she couldn't speak or understand anybody for 20 minutes. So So we talked to her and got her permission to work on her and her parents, and we set her on the table, and as we leaned her back, she went into a seizure. And so it was full-blown with, I don't even know how they breathe when they're foaming like that. It's just really scary to me. But here this precious little girl is in a grand mal seizure, and she, I laid her back, and I figured what was causing it was the compression on the meninges, so I grabbed her neck, put the pressure on, and the seizure just stopped immediately. And I'll let you hear the rest of it from her. So here it is.
Like my head's stiff.
So Joy, how do you feel after your first treatment?
I feel good, much better than I did before, and just the seizure was much
you
better.
had one of the episodes while you were at the beginning of treatment. So how do you feel? How did you recover after that episode resolved?
Like a seizure?
Yeah.
Yeah.
I came back almost automatically because it was a little sensitive near my ears, but it helped me come back awake, and I was much more responsive afterwards.
How long do those seizures normally last?
Anywhere from 8 to 17 minutes.
And this time it lasted
Less than a minute.
I was going to say less than a minute.
while we were working on her.
Yes.
Yes.
The interesting thing is you started the seizure before we started working on you,
Yes.
and I grabbed your neck right away and worked on it, and it stopped it,
Yes.
which made me super happy.
Yeah.
Us too.
Now,
Yeah.
one of the things that Joy had was a chronic headache for the last couple weeks. So Joy, how does your head currently feel?
It feels better right now. I still have a little bit of a headache, but it's definitely subsided since.
Now, I understand this whole thing started with a spider bite in your foot,
Yes, sir.
and then it left you 3 weeks ago, and it left you with severe foot pain. You couldn't put your foot on the ground, but you can now,
Yes, sir.
and you actually took a step on it,
Yes.
Good.
which is like really what that means, that you should be doing real well soon.
Yes.
Absolutely.
Does the head
That's
feel better
amazing.
too?
Yes.
You had headaches, that's gone?
Yeah.
Okay. So after a seizure, normally you wouldn't be this alert?
No.
Okay.
I would not be able to talk to you.
So I think we found, what's really interesting is it looks like that spider bite set something off that triggered this whole upper neck problem, that we were able to take the pressure off the spinal cord structures, stop the seizure, stop her headache, and make her foot feel better. There's a whole theory behind all that we don't have time to get into, but
That's amazing.
Yes.
there you go.
That's
I'm
amazing.
glad you're feeling better.
Thank you.
Thank you.
So this is why I'm so excited about what we're doing, is that we're able to give people like this their lives back again, and save lives. I think I'd mentioned earlier that we had 3 people in 2 months that had appointments at our office that took their lives before they ever got there, which is a really big story, because what that means is that they have so little hope in getting well that they don't even want to try one more thing. And so many people will not even get out of the house and go somewhere because they've been to so many places, spent so much money, and they're so discouraged that they just give up on life and oftentimes take their lives. Like the foot pain like that would be a classic CRPS, but that's called the suicide disease. Many of those people take their lives. The fibromyalgia patients, they take their lives too, because sometimes it's just really unbearable. There's over 50 million people in our country, 50 million people in our country that are suffering from chronic pain. That's just the documented ones. The undocumented ones, who knows what that figure would really be. I figure if I trained 1,000 people a week, I could barely make a dent in that number. It's so huge. But every office in the country, every medical office, dental office, every chiropractic office, every holistic office, the naturopaths, massage therapists, everybody needs to know about this so they know how to test, they know how to take care of these people so that we can get 50 million people well. So let me talk a little bit about what you might expect if you were going to take our training and be a practitioner. This is Eric, and we just finished a training with him. He's a French guy, lives in Florida, and we actually it was when we were very first starting out here, just a few months ago. And he, anyway, I'll let him speak for himself.
Hi, my name is Eric Noel. So was here all day with Dr. Paul learning a new technique how to manage pain, and it's incredible the result I get. So I had about 10 people coming into my house today, and they all left with like almost zero pain, and some of them like 40 to 60% less of what they're going through in a daily life. It's pretty amazing and powerful. Neurometrics with Dr. Paul, it was phenomenal. One of my cases, the hardest case that I have, I've been working with him for over 2 months in spinal flow and get him like better and better with his sciatic nerve. And then in a matter of like 5 minutes, the pain completely vanished, gone, and no discomfort at all. So this is pretty magic. I can't wait to keep going. So just wanted to share this, and you're probably going to see the testimonial following this. Again, Eric, Paul, thank you very much for what you're teaching me.
So, with your permission, I'd like to go over some different ways you can work with this as a practitioner. And it's been 22, actually it's about 23 right now, years developing and simplifying our protocols. It all started off with manipulation, and I developed some manipulative techniques that we could use. And then when I started teaching, of course, I taught manipulation, so I was limited in who I could teach. And so I was really only teaching chiropractors and medical doctors how to manipulate the neck to help people with fibromyalgia is what we started with, and then it turned into trigeminal and CRPS and most of your neuropathies. But recently, a couple of years ago, started working on new protocols, and it turns out that simple pressure techniques that you would use with like acupressure actually work much better than the manipulation, which, to tell you the truth, I was happy about, but I was also a little sad about, because I really like the manipulation, because that's what I've done my whole life, and I figured that was the big magic bullet, and it turns out that it wasn't. And so but the good thing that came out of that is it's something now we can teach naturopaths, massage therapists, all your holistic profession that, is legal for them to use pressure techniques, and even the lay people who want to get certified in this. And so we can teach people how to take care of other clients that are coming in with these severe pain conditions without really having them to have to go through med school now. So terribly excited about that. And then we have a company that we use to license them. So after they're certified, we can use another company that we use to license them and keep them 100% legal and protected, doing all the right things. That's what we always want to do. So you can now get sufferers with these severe conditions relief from chronic body pain and help them to regain their lives again as they once knew it, without having to invest the cost or time, of going to school to be a chiropractor or an MD. And we're not cheating here. We're just creating a slice, just a slice of people that we're working with, and a system that's we've worked out the difficulties where it's relatively simple, and so you can help these people without having to know about diabetes and about heart attacks and about bone tumors and all those things, because it's very light, it's pressure, it's no more than like a cranial sacral. We're not using any more pressure than cranial sacral or any of those techniques, but it works many, many times better. So we're really happy about that. I wanted to introduce Marlene to you, and I'll have to, on another episode, I'll put some videos up, and actually I think she's going to come into the studio and speak with me one time. She was in a wheelchair for 14 years, and she was so sick, later she told me when she could talk about it, that she couldn't figure out where the forks and the spoons went. And that is what happens to people when you put enough pressure on that meninges and you pull in enough nerve roots totally overwhelms the brain, and it makes them into another person, and it keeps them from being able to function normally. They call it fibrofog. If you make fibrofog bad enough, now they call it insanity. That's a joke, but you get the point. In her case, she couldn't even sit up when she got to the office, so we worked on her and got her completely well. And she was so excited about it, she wanted to work with us, and so she would travel with me, and we would travel around the country and speak to different fibromyalgia groups and different chronic pain groups, and she would speak and tell her story and how she got well and what she saw in the office, and how she saw the other patients getting well, and she deserves an accolade for who she is and what she's been through, and who she is today. And she called me the other day and was telling me how happy she was. And I said, you want to work with me again? She said, yeah, I'd love to work with you again. So you may be seeing more of her in the future. We'll see how that goes. So a review of our services. Sometimes these slides don't load right away. So we're the Chronic Pain Academy. We have a system that in my office, and I don't want to brag about this or make a big deal about it. I just want to let you know that if you're going to do this and invest time and effort into it, you're going to be getting people well. You're going to be helping people you never thought possible to be helped. You're going to take all those really, really sick people that have been seeing the rheumatologist and MDs without help and taking lots of medicine, and getting them off their medicine and getting them well. Obviously the MDs need to take them off, but you get them well, then send them back and let them get them off. And so we were so busy. We were seeing 165 visits a day and collecting about $210,000 a month. Now, I've got people I've trained that are doing 5 times that much a month. It's an incredible thing to be able to help that many people. And of course, hopefully you'll make a little money at it, and hopefully you'll take a good part of that money and put it back into helping more people. That's what we did. And then this is Dr. Doug. I talked with him a couple weeks ago. This guy is outrageous. He came to me in Dallas and said, I heard about what you're doing. I have a problem. Actually, it's my wife's problem. She said her breasts hurt. And he said, can you help her? I have no idea. I've never seen anything like that before. He said, nothing else hurts. She's just fine. And I go, well, bring her to me. Let's see what we can do. So I worked on her neck. In about 5 minutes, they quit hurting. And he goes, I'm in. I'm taking your seminar. And so he took our seminar. And then that was in June when he was seeing about 75 patients a week. And by August, which was 2 months later, he's seeing 235 patients a week. And so he called me and told me, I go, how did you do it? He said, I didn't do anything. I just went home and started talking to people and letting them know what we found, and they just started pouring into the office. Now, most of the time it's not that easy, and he did have a practice to start with, and this is another doctor that I trained, and he came back and told me he collected $48,000 in a day, and I go, how in the world did you possibly do that? And he goes, well, I just put a seminar on. Then I signed up the people that came, and that's how much they paid in their prepay. And so that was nice. And so it makes me feel terribly uncomfortable, actually, to talk about money. But I think it's important to know that probably, if you're picking up a new patient every day, you're probably going to be doing about $100,000 a month. It's kind of something like that. But you need to know that, because if you're going to make an investment into it, you need to know at least you're going to get your investment back. And that's kind of what happens. Is it easy or hard to build a practice? It's hard. If you're a go-getter and you start doing seminars and letting everybody know about it and doing a little advertising, you'll be very, very busy. If you just sit and wait for them to come in, you're probably going to be very, very slow. But it will grow and get big as long as people know what you're doing and you do a good job. So how you get started, if you're ready to change your life, your income, your confidence level, you can get a hold of us. You can go to our website, which is chronicpainreliefacademy.com, chronicpainreliefacademy.com. You can call 530-307-2398 if you like, and you can get a hold of us that way, 530-307-2398. And give us a call. Let us know when you're ready to move forward. If we can, we'll plan a training in your area, or you can come to our trainings, wherever we are. And there's our contact number again. And thank you very much. That's the end of this segment.
We do like a call to action. So like if you are interested in learning more, make sure you reach out, something like that.
You want me to do a call to action right now?
Yeah, just a call to action to kind of wrap it up.
So what I would say right now is you can, if you're interested in this, call us right away. Give us a call. Let us schedule a seminar, hopefully as close to you as possible, and we'll make sure you get trained. And if you've got a staff, we can train them also. The other thing that I didn't mention here in this segment is that we have a program where if you're really sick or your spouse is really sick, we can take the healthy spouse, bring them to our training, and train them and send them home to take care of you or your spouse without having to spend all the money in hotel rooms and rental cars and eating out and all of those things. You can actually just train your spouse, go home and your spouse can take care of you, or if you have a spouse that's sick, you can come out, take our training, and go back and take care of them, and we'll give you all the support you possibly could need during that too. So it's not just for health practitioners, it's also for, for people that have sick spouses, and we can help you with that. We really like it if you bring that spouse with you, so we can do an evaluation and test and get you started in the right direction, make sure that you know what you're doing. But by the time you go home, you'll know what to do. So thank you so much.
If you're ready to explore real solutions and finally put an end to chronic pain, visit the Chronic Pain Academy and discover the options that could change your life. Don't forget to subscribe so you never miss an episode. Your journey to lasting relief starts here.